Why is intravesical chemotherapy effective for bladder cancer? Imagine a treatment that targets cancer right where it starts, with minimal impact on the rest of the body. That's exactly what intravesical chemotherapy does for bladder cancer. It involves placing chemotherapy drugs directly into the bladder through a catheter. This method is especially useful for non-muscle-invasive bladder cancer, which tends to come back or get worse if not treated properly. The main reason it works so well is because it delivers high doses of drugs like mitomycin C, doxorubicin, or epirubicin straight to the cancer cells lining the bladder wall. This direct contact means the drugs can attack the cancer cells effectively without being absorbed into the bloodstream in large amounts. Because the drugs stay in the bladder, they can kill residual cancer cells left behind after surgery and prevent the cancer from returning. Clinical studies show that intravesical chemotherapy can cut down the chances of bladder cancer coming back. For example, using mitomycin C after tumor removal can reduce recurrence rates by around 41%. This makes it a powerful tool in managing bladder cancer. To make the treatment even more effective, doctors sometimes use techniques like alkalinizing the urine to improve drug stability or heating the bladder during treatment to increase drug absorption. These methods help the drugs stay in contact longer and penetrate better into the cancer cells. Sometimes, intravesical chemotherapy is combined with immunotherapy, like Bacillus calmette-guerin, especially for higher-risk cases. Giving chemotherapy before immunotherapy can improve the chances of staying disease-free longer. Because the drugs are confined to the bladder, patients usually experience fewer side effects compared to systemic chemotherapy, which affects the whole body. This localized approach allows for higher drug concentrations directly at the tumor site, reducing the risk of systemic toxicity. Another key benefit is that it targets microscopic cancer cells that might remain after surgery. These tiny cells can cause the cancer to come back, but intravesical chemotherapy helps eliminate them and prevents tumor implantation in the bladder lining. In summary, intravesical chemotherapy is effective because it delivers potent drugs directly where they are needed most. It reduces the risk of recurrence and progression while minimizing side effects. It is a cornerstone in treating non-muscle-invasive bladder cancer and is often used alongside other therapies to improve outcomes. Always remember, treatment plans should be personalized, so consulting with a healthcare professional is essential to determine the best approach for each individual.